Thanks for your interest in the Community Confidence Project. I'm Tommy Bohrmann, the Chief Scientific Officer at DHIT, the Digital Health Institute for Transformation. We'll take just a few minutes here, so let's jump right in. First, let's consider the problem we were tackling. The unfortunate reality is that our community decision makers are often forced to make decisions with little or no objective data. That reactive and subjective decision making often leads to far from optimal scenarios. And we wanted to address that, particularly in the time of COVID, which has added an incredible layer of complexity to all of our lives. We wanted both our leaders and our communities to have confidence in these decisions. We also wanted to ensure that the voice of North Carolinians was heard, and that became a key feature of the Community Confidence Platform. The solution that resulted is a decision support platform, a web application, as well as available insights reports like the one shown here that summarize the key metrics and insights that one would obtain from an analysis using the Community Confidence web application. Think of this as the key results delivered by your analyst empowered with the Community Confidence application. We've seen a large number of dashboards and other technologies developed to address the COVID-19 pandemic, so let's describe how our approach is different. Perhaps the most critical is the inclusion of the opinions and sentiments of our North Carolina residents. During the development of the Community Confidence Platform, we conducted a specialized survey of more than 3,000 North Carolinians to understand how they would make trade-offs and prioritize key health and economic elements in their communities. Think of this as helping to reveal which businesses are most important and what type of COVID numbers might we live with in order to bring our economy back up to speed. These are hard choices that we worked hard to formalize within the Community Confidence Platform. The result is that many of our reported metrics demonstrate how confident our residents feel, and the critical top-level confidence score reveals how comfortable our residents are with a given scenario overall. The metrics we've included span the range of behavioral, environmental, economic, community health, and capacity and care, and come from a wide range of data sources. I want to take just a brief moment and share a few views of the live Community Confidence web application as well. Here you can see the scorecard for Ashe County from early in March 2021. The top-level confidence score of 40 tells us that late February's conditions in the county based on economic activity and COVID-related health metrics was fairly poor. The accompanying health score suggests that the COVID-related metrics, in particular, namely the cases and the COVID-related deaths on a per capita basis, was also unfortunately poor when standardized and compared across counties in the United States. By investigating some of the individual metrics below, we can see some of the particular areas of concern as well as the strengths. To dive in further and see the data, we can always click on the information icon and we'll see a blurb that gives us more context. An additional powerful section of the platform is the simulator section, where we can identify how various actions might improve both the health and confidence scores 4 weeks from today compared to doing nothing. This is all based on modeling projections behind the scenes. A number of potential policy recommendations under the economic and behavioral indices are presented. By clicking on the potential recommendation, we can simulate the impact of enacting that policy or making that change. We'll see in some cases that adding additional interventions has little impact on top of others. We welcome questions and ideas about how we can expand and apply our technology and meet additional needs. But I want to also take a moment and acknowledge the team behind the Community Confidence Project. From our supporters to our visionaries to the technical folks, this has all been a tremendous team effort. In closing, I want to thank you. You can reach me directly at tommy@dhitglobal.org, and you can visit us on the web at our main dhitglobal.org website, or check out the communityconfidence.org website as well. Again, thank you.